At the end of 2019, the world was moving at its usual pace. Crowded airports, busy cities, events, hugs, meetings. Life was fast and more connected than ever before in history, thanks to the internet. Then, in December, doctors in the city of Wuhan, China, identified cases of an unusual pneumonia. Patients had high fever, persistent cough, and difficulty breathing. Something seemed different. In January 2020, scientists announced the discovery of a new coronavirus. It would be called SARS-CoV-2. The disease it caused would be named COVID-19. At that moment, few imagined the world was about to enter one of the greatest public health crises. In March 2020, the World Health Organization officially declared, we were facing a pandemic. The virus spread quickly and silently. Transmitted mainly through respiratory droplets and aerosols, it found its primary pathway in human contact, and the modern world offered exactly that. Global connections. Within a few weeks, borders began to close. Flights were cancelled. Countries declared states of emergency. Entire cities went into lockdown. Once busy streets became empty. Schools closed. Offices shifted to remote work. Hospitals prepared for the worst. In the first months, little was known about the virus. There was uncertainty, fear, and misinformation. Symptoms varied: fever, dry cough, loss of smell and taste, intensive fatigue. In severe cases, respiratory failure. Most young people experienced mild symptoms. Elderly or immunocompromised individuals developed critical conditions. Health systems began to feel the strain. Intensive care units were full. Professionals were exhausted. Protective equipment was in short supply. In countries like Italy, hospitals reached the limit of their capacity. Images of silent cities and military convoys transporting coffins marked the collective memory. In the United States, the number of cases grew rapidly. In Brazil, the virus also spread through capitals and inland regions, impacting urban and rural communities alike. Meanwhile, scientists around the world worked at an unprecedented pace. The genetic sequencing of the virus was shared internationally within days. Laboratories began a race against time to develop safe and effective vaccines. Normally, this process would take years, but the urgency was global. While vaccines were not yet available, containment measures became essential. Mask use, social distancing, constant hand hygiene, expressions like flatten the curve and social isolation became part of everyday vocabulary. The pandemic affected not only physical health. Isolation brought deep emotional impacts. Anxiety, loneliness, and uncertainty became common feelings. Millions of people lost their jobs. Small businesses closed their doors. At the same time, stories of solidarity emerged. Healthcare professionals were applauded from balconies. Communities organized donations. Science demonstrated strength. At the end of 2020, a concrete hope appeared. The first COVID-19 vaccines began to receive emergency use authorization. Among them were immunizations developed by international consortia and research centers using innovative technologies, such as messenger RNA. In December of that year, the first doses began to be administered. It was the beginning of a new phase. Mass vaccination drastically reduced severe cases and deaths in many countries. Although the virus continued to circulate, its impact began to decrease. Where vaccination coverage advanced, but SARS-CoV-2 was also evolving. New variants emerged, some more transmissible. Each new wave brought renewed challenges. The pandemic revealed deep inequalities. Countries with greater access to vaccines were able to move forward more quickly. Regions with fewer resources faced greater difficulties. Even so, international scientific cooperation was historic. Never before had so much research been published in so little time. Never before had vaccines been developed and distributed so quickly. The pandemic also transformed habits. Remote work became common. Virtual meetings replaced in-person gatherings. Telemedicine expanded. Digitalization accelerated years within just a few months. Masks became a symbol of collective responsibility. More than numbers, COVID-19 represents stories. Stories of irreparable loss. Millions of lives were cut short. Families said goodbye from a distance. Rituals were altered. But there are also stories of resilience. Patients who survived long hospitalizations. Scientists who dedicated sleepless nights to research. Healthcare workers who remained on the front lines. Despite the risk, the COVID-19 pandemic was a global test. It tested health systems, it tested governments, it tested the capacity for cooperation among nations, and it tested every individual. It showed how connected we are. A virus identified in a specific city quickly spread across all continents. it also showed the importance of evidence-based information. In times of uncertainty, science became humanity's greatest ally. Today, although the situation is different from those early days of 2020, the effects still echo. It left social, economic, and emotional marks. But it also left lessons. The importance of epidemiological surveillance, the value of investing in research, the need to strengthen public health systems. Above all, COVID-19 revealed something fundamental. We are vulnerable, but we are also capable of innovating, cooperating, and enduring. Amid physical distancing, many people rediscovered the value of human contact. Amid crises, science advanced. Amid fear, acts of courage emerged. The COVID-19 pandemic will be remembered as one of the most transformative events of the 21st century, not only because of the virus itself, but because of the profound impact it had on the way we live, work, and relate to one another. It reminded us that health is a collective good, that individual decisions affect entire communities, and that, in the face of global challenges, the response must also be global. The story of COVID-19 is still being written, but one thing is certain. The world that emerged from this pandemic is not the same as the one that existed before it, and the lessons learned will shape the next generations. If you enjoyed this video, subscribe, like, and share. See you in the next story.